No notes. Okay, great. Okay, so we will go ahead and get started. When I'm in this presenter mode, I can't see the chat.
I can follow it. I'm happy to follow when you're, yeah.
Interrupt me if at all needed. Okay, so we'll get started today. Thank you so much for having us. We're excited to be here. Our focus today is going to be on how to write strong letters of recommendation so that we can communicate effectively on behalf of our applicants. And we'll also spend a little bit of time talking about how to avoid having biased language in our letters as well. So we hope that by the end of our session, we have given you the information and the resources that you need to help understand the perspective of those who are reading letters of recommendation so that you can optimize how you write your letters, as well as help you develop a framework so you know the key concepts and which information is most important to write an effective letter of recommendation. And we also hope that we can give you some background knowledge on the existence of gender and racial biased language in letters of recommendation so that we can work towards writing letters that are devoid of such information. So we'll start with a little bit of information about why letters are important. We'll jump into providing you with a framework of organization and which key concepts should be included. We'll do a really quick group activity to kind of get us primed and thinking about biased language. Then we'll jump into the problem of biased language, give you a little bit of that background information, and then focus even more on how we can avoid having that in our letters. And at the end, we have some resources for you that hopefully you can practically take and use in the future when you are writing your letters. So I think probably most of us know, but the purpose of a letter of recommendation really is to provide finer detail than the standard application. So you can only tell so much about an applicant from their CV and their board scores and kind of the numbers of it. So the letter of recommendation is your chance to delve in and give finer detail about who the applicant really is and what their qualifications are. In an ideal situation, the letter will provide an accurate and fair assessment of an applicant's abilities. But I think, as we all know, this can be challenging to do, but that's our goal. I had always wondered in the past, how important is this letter that I'm spending so much time writing? So I do think it's helpful to understand how program leadership views letters. There was an NRMP study in 2016, and the results of that indicated that program directors for both residencies and fellowships do rate letters of recommendation as important, both for when they're selecting who to interview, as well as later in the process when they're deciding where to rank applicants, and that the letters of recommendation do influence their impressions of an applicant in both positive and negative ways, depending on the letter. And so I think a lot of people know that writing a letter can be challenging, and what specifically do we need faculty development to focus on? So there have been concerns that especially residency applications are kind of uniform, which, as you can imagine, renders these letters that we're spending so much time on a little less useful. And we really want to be able to communicate a little bit better than that. And then there have also been some concerns that letters are written in a way that requires some decoding. And if you don't know that code, it's both hard for the reader who's trying to figure out what you mean by the sentences that are on the page, as well as challenging for whoever's writing the letter and wants to figure out how to express themselves well and get across the point that they're really trying to get across. So important to be starting to learn about all these concepts. So with all that in mind, I will hand it over to Arvind to talk a little bit about how to organize your letters.
Thanks, Katie. Just want to make sure I'm not just talking to myself. Good, we're unmuted. So I think what I'd like to talk about in brief is letter organization. So bottom line is, pun intended, no structure consensus. There's this narrative versus standardized letter of recommendation. The narrative letter of recommendation is what we all in general typically write here. It's based on personal or academic attributes, and it's essentially the gold standard. And the problem is it does have problems. It doesn't really predict how well a trainee is going to perform at the next level. There's poor agreement on what terms mean what here. As we all know within our residency program, Jen and Ben have moved mountains to really try to help us interpret letters of recommendations for residency applicants, for example. And there's various means, there's differences in how we interpret those letters. Certain words, people catch certain things that might mean something versus might just reflect the personality of the letter writer. Some people may feel that the longer the letter is, the better the person feels about the trainee, which may not necessarily be the case. I'm not going to the next slide, Katie, sorry. So then we come to this, should we be doing following like a standardized format for letter of recommendation here? These, according to some data outside of pediatrics, to be honest, have been shown to be better performance predictors, especially if they're looking at competencies, patient care, procedural skills, medical knowledge, and communication skills, for example. And it's better to increase inter-rater reliability, and they're easier. Bottom line is they're easier to interpret, regardless of who's reading them. Unfortunately, as within pediatrics and even other subspecialties, it's not yet the gold standards. There's a lot of templates. We're going to share one at the end based on consensus among some of us here. Thus, I think it'd be helpful. We think it'll be helpful for this session to really talk about how we can optimize the narrative letter of recommendation. I'm going to the next slide.
I'm trying, sorry.
Oh, no, sorry, I didn't mean to.
No, you're okay. There we go.
I wish I could take control since I'm not, but I apologize for asking. So looking at the narrative of letter organization for the narrative letter of recommendation. So some suggestions here are your openings. So who you are and your expertise in brief. Okay, let's be honest. When we're reading these letters, we just see who they are, and you can make this 2 lines, 7 or 8 lines. I mean, the reader is really not, to be honest, caring too much about that. It's just more of how much experience you have with this person is the key point here. The body is specific examples of your interactions. So whether that be with clinical interactions, or if you're a scholarly mentor in addition, or only the details of your interactions from a scholarly standpoint. And the closing really comes down to is, should we recruit this person? And would you hire this person as a partner, depending on what this letter of recommendation is for? This is general, so the next slide we're going to go into a few more details here. So for the body of the letter of recommendation from a narrative standpoint, some things to consider. So elaborate on their CV. So things that you think help differentiate this applicant, or things that perhaps they've done on their CV, which by the nature of the format of CV require elaboration, which maybe you had some more interpersonal interactions regarding. You don't need all the details. I mean, as you know, when we're reading letters of recommendations, you're honestly reading other things too about the applicant, so it's an opportunity to enhance what's already in the application. The competencies, as I mentioned, this reflects some of the positives of a standard LO, letters of recommendation. So specific examples and comments are helpful. Again, length doesn't mean better. The specificity and comments are most helpful here. And the same thing goes from a scholarly work standpoint, and particularly follow through. They've done 20 projects, right? They started 20 projects, or they've done 2 projects or 1 project, and they've really followed it through to the end. And I think it'd be helpful in case you are aware or discussed with the applicant any reasons or what they've done, and any when they've been outside of training for any particular reason. I will credit Deb Bogan and Diana Plouffe, who sadly don't work here anymore, but for good reasons, for giving the details for this slide. So what are some? So we talked about these verbiage, right, which may be interpreted differently amongst people who are reading letters of recommendations here. And so some qualities that program directors seem to have some consensus of here. So there's work ethic. Are they trustworthy, team player, professional? Are they compassionate? And other qualities here, which are probably not as most helpful: maturity, resilience, leadership, resourcefulness. Or are they inquisitive? And so I think, and then we talk about what's helpful and what's not here. And then we talk about what really can be helpful here is depth of interaction with the applicants. So the specific traits of the applicants and their abilities, and looking at the bottom line here is how strong do you feel that they should be going to the institution they're applying for. How much do people care about really the advanced degrees and the length of the letters? Not as much. Advanced degrees probably because they're seeing those qualities in other parts of the application, and a lot of people can read that themselves. And then, so when we talk about words, right? Now we talk about key phrases. So when you talk about program director agreements, amongst what would be helpful for their interpretation is key phrases here. I give my highest recommendations. We would like them to stay at our institution. They exceed expectation. We highly recommend, will be an asset, right? And things that come across as not the most positive for applicants here are, as you can see on the bottom, I recommend, right? What's missing between I and recommend? Solid performance, right? That's a great word, but it's purposely a little bit vague and ambiguous and perhaps negative. Showed improvement. There seems to be consensus among people thinking that there was something that needed to be improved, and perform at expected level. So this is an average applicant. So I think the bottom line is that what a letter of recommendation can deliver or enhance. It's wide ranging of specifics, but really looking at engagement, their emotional intelligence, and their resiliency, and responsiveness to feedback. So shows improvement, not helpful or not really the greatest, but responsive to feedback is, I think, as we all can agree, super helpful, and not necessarily a negative. And as I mentioned, it's an opportunity for all of us to elaborate on our interactions from a scholarly standpoint with applicants if we have those interactions, and to enhance what they've done on their CV, and note perhaps the work, the follow through, the perseverance they've had, and the engagement they've had towards those ends. So Katie and I are going to work with you guys on a group activity. And Katie, since you can't see the chat, I'm happy to monitor the chat if you want to go over the activity itself. If that's easier for you, or you can flip, whatever's easy for you.
Yeah, I thought I could. I think I got. Let me see. I got the chat back actually. So I think, yeah, I found it.
Awesome. So I'll just go over the activity here, and then Katie's going to look at the chat and reflect on what you guys put there. So take a look at the following sentences. XX is a bright, dedicated, and caring student. XX was strongly motivated and worked diligently on this challenging clerkship. Remains upbeat despite difficult situations with complicated patients. All of their team members felt strongly that they were reliable, intelligent, and a delight to have on the team. They will be an excellent physician and a strong addition to any residency program. Okay, so as you can see, the prompts here we have for you all is either unmute or put in the chat. What's one strength? Is there gender biased language? And is there racial biased language in this blurb from a letter of recommendation? And you can answer any or all of those questions in the chat, or unmute yourself.
So I would say that a strength of the applicant would be intelligent. It's interesting about the gender-based language, because we talked about this in our group, that in pediatrics, we do actually highly value certain characteristics, such as the humanistic qualities of a student. And so yet we also hear that those are more gender specific. So I would have to say that in terms of gender-based, I would say caring would make me think more that this applicant was more likely to be a woman.
Thanks. Yeah, thanks. Thank you.
And then in the chat, Dr. Rapkin said that a strength is the ability to remain upbeat in difficult situations. Dr. Luneau said strength, attitude, team player, reliable, and a possible gender bias is that the student or applicant, I guess I don't know, it's a student, is a delight. That's a really great point as well.
This is Tracy. I'm driving, so I can't type or shouldn't type. But I agree. I think there's clear strength here, and I think they're really highly valued strengths. Didn't even cross my mind. Male applicant. I think it's because delight and upbeat and caring, and those were some of the words. I think it was the number of them and clustered together that made me think that, and maybe that's me thinking that men can't be a delight, but there was something about it.
Okay, so you're echoing Marin's, Dr. Luneau's thoughts in terms of delight is seems a little bit, it does seem gender biased. Thanks, Tracy.
Yeah, and Dr. Zuckerbrand says gender bias. I agree with Tracy. Reminds me, or strikes me as a female applicant. Yeah, I agree with all these thoughts, and I think, oh, Dr. Tartici says I agree with Tracy. Men can't be a delight. Sounds like, yeah. Thank you, Tony.
Awkward. So,
oh, you're not used to Tony's comments. I'm sorry.
So I have a question. If you see this if you know that the person is male and you see that it's a delight, how would you take it? I mean, we're assuming we don't know the gender, but if you knew the gender and it was male, how would you interpret it?
I think that's the question. I think that a delight to me sounds positive regardless, but I think we've all recognized that it kind of sets off a stereotype in our mind, and without even knowing the name or the gender, we all have someone can picture someone in mind that we think of. So I don't, for the most part, feel like I would ever think that somebody being a delight is necessarily a bad thing. It's just about how you evoke stereotypes with the words that you choose. And Dr. Sinceri says, I'll play devil's advocate. I am not sure I feel delight is gender specific. I start all my clinic notes with XXX is a delightful X-year-old XXX.
I agree with that. It may be that when the age gap between the referee and the referred is large, you're likely to use delight. Because then, it sounds like you're talking about a younger person, like a patient is a delight, because we all take care of kids.
Yeah.
I will say, at least having spent a little bit of time reading it, it's almost a bias in that this is the type of thing people tend to put in letters about women applicants, whereas the male applicants, they talk about how smart they are. Which is
that's what I was saying to Tyler too. That's how I felt about it. Like it's not negative. That's a double negative. Delight is positive to me, but I think if it's a female applicant, you could probably choose a different word, right? Is that what you're?
Yeah, I spent all of my time as a fellowship director who's looking at what's not said. And this talks about what a nice person this is, but doesn't necessarily spend as much time talking about how smart they are, what a good researcher they are, or how they ran circles around everybody on their rotation, that type of thing that some other letters might. And maybe that's intentional and maybe that's not. Maybe they were somewhat nice, but not very good at their job. But it kind of feels like that.
But if you have reliable and intelligent and delight, then I'm not sure I would say that this is not a valued person. Plus, they're saying that deals with difficult situations well.
Yeah. And I think that is the challenge of all of this, right? I think, well, actually, one of the reasons I included that last sentence was to make it clear that this is a positive sentence is from a positive letter of recommendation. We like this applicant, but thinking about which words go in to make it even stronger or less strong, which ones raised out, which ones lead into some stereotypes. So I think so many great points have been raised, and I think there have been some great segues into what we'll talk about next. Please feel free to drop things in the chat as we keep going, because I love hearing kind of all of your thoughts and perspectives on this. All right, I am going to close the chat now, though. So Arvin, if you could keep an eye on it, that would be great.
Absolutely.
Thank you. If I can advance, there we go. Okay, so now we'll shift our focus to really paying attention to how gender and racial biases play out in letters of recommendation. As you can imagine, the lack of a standardized structure and the subjective nature of writing a letter is kind of a ripe area for there to be some implicit biases that surface. We've kind of framed it in a way that first we want to help you understand, help all of us understand that bias does exist in letter writing, and to show some of the data that's out there that helps us see this, but then also talk about how we can avoid including this, or at least minimize this when we write our own letters. And then at the end, we just have a few like really quick tips and tricks for checking yourself as you work. I'm going to start with gender bias today. I think we're all pretty aware that gender bias does happen in medicine, and unfortunately, letters of recommendation are really no exception. There are a handful of studies that have been done within academia broadly, as well as specifically within medicine. So I'm just going to start by reviewing a couple of the studies that hit on some of the key takeaways. So this is a study that was done by Madeira and colleagues in 2018, and they analyzed letters of recommendation for an academic position or multiple academic positions, and they rated those letters for different types of doubt raisers. So the doubt raisers they looked at were negativity, which are comments that specifically point out a weakness, things like saying does not have much teaching experience, or there's faint praise. That's saying things like needs only minimal supervision, which is kind of like a backhanded compliment. Hedging is saying things like might not be the best, which is really refusing to take a clear stance and indicates some level of uncertainty about the applicant. And then the final one they looked at was irrelevant information. So things like active in the church, which mostly makes the reader wonder why that information is there and why might they not be putting more relevant information there. So in this study, they controlled for 10 different academic performance variables, things like number of publications, number of years as a postdoc, and they found that there was no difference between genders in these variables. But when they did look at doubt raisers, they found that both male and female recommenders used more doubt raisers when writing letters for women than for men. So essentially everybody, men and women alike, are writing using more doubt raisers when talking about a woman. They also looked into whether or not these doubt raisers have any effect on the overall outcome for the applicants, because if there isn't an effect, then the presence of the doubt raisers, well, maybe still a little uncomfortable, is really a less important thing to look into. So not surprisingly, they did find that the presence of doubt raisers, especially negativity and hedging, when they are present, there is an effect on the outcome for the applicant. So their conclusion was that since there are more doubt raisers in letters of recommendation for women, overall women are at a relative disadvantage in the application process. This is another study that was done in 2016 by Dutt and colleagues, and they were looking at the relationship between gender and letter length, which had previously been shown to be associated with letter strength. I think we know more now that at least within pediatrics, there really isn't a connection between letter length and how strong the letter is perceived to be. But they also looked at the relationship between gender and letter tone. And these were actually many, many letters submitted from all over the world. So what they found was that female applicants were half as likely to receive an excellent letter versus a good letter when compared to their male counterparts. And that once again, they showed that men and women recommenders showed no difference in writing stronger letters for men than for women. So it really doesn't matter the gender of the recommender. When they looked at length, which we care a little less about, they just found that in the Americas, we have a lot to say. We write longer letters than anywhere else. But this difference in tone, the strength of the letter, the excellent versus the good, they found that distributed equivalently across all the regions. So the studies that I just mentioned are from academia in general, but these concepts of there being a difference in letters for men and women have been repeated over and over in medicine. I wasn't able to find one that was specific to pediatrics, but I don't think there's any reason to believe that it doesn't occur in pediatrics with how broadly it's found in all of the other specialties that have looked at it. These studies that I've listed here are just a few of the examples that I came across, and they look at things such as the overall letter strength, the use of doubt raisers, the differences in agentic versus communal language, which is something that Arvind is going to talk a little bit more about. So on that note, I'll hand it over to him.
Thanks, Katie. So what I'd like to talk about now is racial bias in a letter of recommendation, and how that it occurs, and what are its implications. So bottom line is that there's a pun intended again. So there's data paucity on the implications of racial bias in writing letters of recommendation, both in medical education and non-medical educational literature. So I'm not sure if this is the right term. To be honest, I kept looking to see if it was the right term, and so correct me if I'm wrong. In the general education literature, educators are susceptible to the negative stereotypes about ethnic groups, and their expectations play a role in perpetuating these gaps in achievement between ethnic groups. And there's been concerns raised for implicit bias and their role in letter recommendation writing. And what I hope to do in the next couple of slides is to review the known studies for showing this problem in the medical education literature. And so what I'll talk about here is keyword use, agentic verbiage, thank you, Katie, implicit linguistic biases, and then lastly, racial bias across different types of letters of recommendation. So the first study I'll talk about highlights keyword use. So this group aimed to identify differences in keyword appearance and frequency by race, namely gender, academic performance, match outcome, and ophthalmology residency. Oh, man, I didn't pronounce that right. Ophthalmology residency letter of recommendation. And what who they examined were underrepresented minority status. In 2018, underrepresented minority status was first reported. So that's the years that they chose to examine. So 387 total applicants. And what they did was they looked at the 3 letters of recommendation for each applicant. They looked at the frequency of these key words here and the differences across URM status. So, and they got these words, FYI, by studies from a few years back. So standout words, ability words, grindstone words, and then compassionate words. Some examples of the latter: exceptional, best, outstanding, superb, ability words, intelligent, bright, grindstone, organized or hardworking or diligent, right? One word that Katie brought up earlier in the phrase that she used, and then compassionate, so empathic, for example. And what they found is that out of the applicants that self-classify themselves as URM, they're more likely to be described as caring. Along with that, URM status didn't predict keyword appearance frequency. And keep in mind, this is a small number. Moving forward to the next study here. So this is looking at agentic language. Okay, so they wanted to look at the frequency of these agentic language. I'm going to get into this term because I didn't know what it means in the next slide. And radiology residents letters of recommendation, and how to understand the applicant and writer demographic influence. And to be honest, I think Whitney got into this a little bit. Is the word delight, for example, nothing has to do with demographic or writer differences, but sometimes it has to do with what people just tend to write or what their natural tendency is for writing certain things too. So it has to do with the writer itself. And then if this extrapolates to the racial concern here for this study. So they looked at roughly 2,500 letters of recommendation and of 700 applicants. So agency is something that was a new term just personally here. So it's a male stereotype of being achievement oriented, focusing on being competent, aggressive, independent, decisive, and forceful. So big, words. So they developed a library of agentic terms, and they cited, going deep into the article, they cited prior work from general education literature, and they utilized a software to look for the frequency of these terms. And they noted terms that were used over 200 times in their analysis here. And I've given the examples of these terms in the table here. Skill, confidence, strong, lead, intelligent, work ethic, for those of you who are calling in. So they found that writers used fewer agentic terms when describing underrepresented minorities or other applicants compared with white or Asian applicants. Neither writer, gender, or rank qualified differences in the agentic content used between the whites or Asian applicants versus the URMs or other applicants. But when considering race, writers were more inclined to use agency when describing whites or Asians applicants compared to Black or Latinx applicants. There was signal here. And lastly, just to elaborate this a little bit more, so a little bit later, a group looked to see if there was implicit linguistic, I can't talk today, linguistic biases, and when they're looking at specifically radiation oncology applicants, based on race. Smaller group, roughly 500 letters of recommendations and 100 applicants over a period of 4 years. After reviewing and going through this process to where they ran the LORs through a similar word software here, looking at certain themes of grindstone, standout, expressions of desirability, for example, I'm just clicking to the next slide. The computer paused for a second. What they noticed is that underrepresented minority LORs were significantly less likely to include standout descriptors, and there was a trend for underrepresented minority LORs to more often include statements describing patient care. So this is concerning. Okay, so if you go, and then just to end, this last group, again, there's only 4 studies out there. It's not that much. So examined racial differences in letters of recommendations for orthopedic surgery residencies, and looking at roughly 700 residency applicants in a single institution, again, 2018, based on when that can be designated.
Sorry.
Oh, no worries. They combined all the theme categories from those studies and looked at the frequency of these category verbiage. So not only agentic, but communal, grindstone, ability, and standout words. And what they found was, punchline here, in traditional letters of recommendation, grindstone words are more likely to be used in letters for underrepresented minority applicants here. So this gets into in addition, standout words are significantly less likely to be used for those applicants. So I think this raises a concerns of whether or not this raises the question of whether or not standardized LOR letters of recommendation are more helpful. And it kind of highlights that they probably are, because there were no significant differences between white and underrepresented and minority applicants in any of these types of verbiage. So again, highlighting the need, again, easier said than done.
Great.
So now I'll turn the mic back over to Katie for the 3 steps to eliminating bias.
Okay. All right. So I think now that we have seen that there definitely are some differences in language that are used for men and women and for underrepresented minorities in medicine, we can talk a little bit about how we can do our best and optimize our practices when writing letters to avoid this bias as much as we can. So we have some suggestions. They mostly come from a handout that we're going to provide you with at the end from the Commission on the Status of Women from Arizona University. And there are some general principles, emphasizing accomplishments, keeping it professional, being careful not to raise doubt, and avoiding stereotypes. And we'll jump a little bit further into each of these sections and kind of review what we know and therefore what we can do about it. So we've talked a bunch about how much we should be focusing on emphasizing accomplishment. And so just the reminders that letters of recommendation for women are 50% more likely to include grindstone adjectives that talk about the amount of effort given, but not the specific abilities. Whereas letters for men are 4 times more likely to mention publications and more likely to emphasize their actual accomplishments, and not just kind of how they worked along the way. And along a similar line, people of color often have letters that may not highlight their publications and research qualities as much when compared to white scholars. So what sort of things can we do? First of all, just sit down and start before you write. Start by making a list of what are the skills you want to highlight. What were the specific strengths that this person brings, and what is it outside of their personality, and kind of how nice it is to work with them on a team. It may help to refer to the core competencies when you're thinking through this. What is going to be helpful and necessary for the next step that they're trying to get to? What have they accomplished so far that you'd expect or that puts them beyond expectations? This again brings up the utility of a standardized letter of recommendation, but we're just not there yet. So we've talked a lot about how there probably are no words that you need to specifically avoid, but just being careful in how often you're using grindstone or communal language. And is that the only type of verbiage you're using? Or can you get some more of that agentic or kind of standout language in there? And when you've gotten to the end of writing your letter, kind of stepping back and thinking, what's the best thing you've said about this applicant, and does it reflect their skills? So then keeping it professional, we've mentioned that letters of recommendation for women are more likely to have personal information, actually 7 times more likely, according to one study, which, as you can imagine, is almost always irrelevant. So being careful not to put that in there. And then letters of recommendation for people of color are much less likely to give ringing endorsements. So kind of giving veiled praise, minimal assurances. So when we're making those comments, trying to make them a much more professional, strong, ringing endorsement. Other things that we can specifically do when trying to keep our letters as professional as possible are, we've already mentioned, but avoiding personal information. These may be details that a candidate doesn't want to expose. So unless you've specifically talked to an applicant about a piece of personal information that they would like you to focus on or like you to help explain, then keeping personal information out of it. And then I think that's also a really good practice to use for formal titles and surnames for everyone uniformly, because we know that this is a place that's ripe for bias. And so to just in these really professional settings, to be using formal titles can help you just make sure there's not a slip up there. Of course, we want to be careful not to raise doubt. We've talked about how letters of recommendation for women are more likely to have negative comments in them. Letters for applicants who are people of color are more likely to have negative, excuse me, or irrelevant comments, things about their unique background or the ability to speak English. Really raise a significant amount of doubt. So being careful not to include those things. And we've talked about some people view a longer letter as stronger, but I would say that that's less of a focus because we've shown within pediatrics that it's a little bit less important, but probably making sure that you are writing equally long letters for men and women is never a bad idea. I do think that this is a challenging one to focus on because not every person that you're writing a letter of recommendation for can possibly be the best candidate you've ever written a letter for. So having to balance this with wanting to write an honest letter, but not raising doubt unless it's strictly necessary is, to me, a skill that's very challenging and I'm constantly working on. And then, of course, avoiding stereotypes. So I think that it goes without saying that we don't want to evoke them directly. We're not going to say things like she's not angry or intimidating, or that she is. We're not going to say any of that, right? Or that his performance is above what you'd expect for someone with this background. But I think what's even more challenging is to be careful about these words that actually are great words, like caring, compassionate, and helpful, which are more frequently used for women, or words like diligent, dedicated, and helpful, or activist, which are more likely to be used for people of color. And just knowing that without intention, these may be evoking some gender and racial stereotypes, which may not be and likely is not the intention of your letter. So just being thoughtful about how sometimes these words do spark some stereotypes. So I know that, at least for me, this is something I'm always working to educate myself on, and it's a process and I'm constantly growing. And so having just a few ways that I can like really quickly check some things for myself without having to spend tons and tons of time is helpful. So we have just a few last tips and tricks for you. So I think one really easy one is to be very careful when writing letters to not ever use gender or gendered titles. Thankfully, we don't have to use many of these that are listed here, but it gives you the general idea that you don't want to be referring to someone as a chairman, or they are not applying for a chairman position, right? It's a chair or chairperson position, things along those lines. And then kind of within this same vein, a tip that I learned somewhat recently was that at the end of writing a letter, to go through and read the letter as if you've written it about someone of the opposite gender or someone who might be a different race. And if anything that you've read as you're reading through and picturing someone else feels uncomfortable to you, or something that you wouldn't want to say about that other person, then there's a good chance that it's biased language. So just kind of doing that gut check. And then another thing you can do is just skim through your letter for these specific words. And as we've talked about a lot, this is really a challenging balance to strike. These words on the left here are those more communal grindstone terms that are more likely to be associated with women and people of color, whereas the ones on the right are the agentic standout language that are much more often associated with men and are very often the characteristics that are classically kind of respected and desired within academia. So as we mentioned above, these words on the left are all really strong words, right? They're things that I would want to be said about me. There are things that I'm looking for in my trainees. There are things that I'm looking for in my colleagues. We even know that pediatric residency and fellowship PDs are specifically looking for someone who's compassionate. That was at that top of that list of skills they were looking for. They're looking for someone with good work ethic, which is implied by a lot of these words here. But I think that the goal is to think about how well you're balancing these. And did you only use words from one column or the other? When you write a letter for one gender or the other, do you use more words from one column or the other column? So just knowing that it's okay to have someone who's hardworking, but we want to know what skills their hard work has gotten them and what accomplishments they've had because of that ability to work so hard. So the ultimate goal here is to strike that balance that's fair and unbiased and fairly represents everyone that you write a letter for. And then this one is, I think, just neat kind of to help you with that balance. You can go to this website, put your letter in, and it'll spit out results that look like this. And it'll just tell you the balance of how many female associated versus male associated words you've used. So kind of similar to that breakdown I just showed you, and just will give you a quick snapshot of how well balanced the letter is. Perfect. So we did it. We got through all the steps. Thank you all so much for your time and attention. We do have a handout for you that Arvin will drop in the chat. I know this is super small. Don't even really try and read it, but I just want you to know what's in there. We essentially have like a template and key verbiage for the structure of what goes in a letter. We also have an example letter if it helps to see it kind of all put into actual action and letter format. As well as a sheet that has some helpful key phrases and features that you should be careful to include. And then also we have that handout from Arizona University Commission on the Status of Women. And we also wanted to include some acknowledgements here. There have been previous versions of this talk and people who have helped us along the way with the handouts and many other things as we've gone, and we couldn't have done it without them. So thanks to everyone for your help.
Thanks, guys. That was great. Thank you so much. You know, this will be really wonderful to resource out. I'll open up if anyone has any additional questions, but I'd love Colleen for us when we think forward about saving these resources, because I don't know about you guys, but people will contact me and say, I'm writing my first letter. What do I do? And it'd be nice to say, here, watch this, and here are some resources, right? Any questions from the group? I've used that put your letter in. It's fun to see it, and then I go through and like, oh wow, I didn't even think of that, you know. Just a thank you from Whitney. This was great. And from Tony. Well, thank you guys. And I appreciate your time and expertise. And we will look forward to putting this somewhere where others can use in the future. So thanks everyone. Have a good rest of your day.
Thanks,
Thank
Noelle.
you.
Appreciate it.